We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to our podcast today. We're so excited to have Kiana Pizza with us, who has a unique background as a nurse, but was also a patient. And the story that we want to tell today is beyond the 6-week checkup. So she had another baby, our third baby, and this session is all about her progression from having a baby past the 6-week checkup and what she did after that to return to full activity. So welcome, Kiana, to the podcast.
Thank you. I'm so excited to be here.
I'm so excited to talk about your story because your story really, it collapses everything of what we're about. And that is that team approach to healthcare and how it creates the best outcomes. And you've seen that in nursing, right?
Mm-hmm. I've seen it a lot.
Yeah, you see what happens when people don't work together. You see what happens when people come together as a collective, cohesive team. And the outcomes for the patient are just drastically better. What would you say about that?
I think that it changes perspective from patient to patient. But for me, when I have more than one doctor collaborating as a team, your outcomes are way better, because a lot of us don't know what's going on or like how to fix the problem. And we think it's geared towards just one doctor, right? And sometimes we just have to advocate for ourselves and ask the doctor, is this normal? And if it's not normal, who do I talk to? How do I fix it?
Yeah, it's so true.
So,
and this podcast, we want to give you helpful tips to navigate the healthcare system post-pregnancy. So after you have your baby, what are the steps you need to do to return to full activity? And it's not just getting the clearance at 6 weeks from your OB. There's a whole team approach and a step-by-step process that you can go through. And Kiana's done that. And she's done remarkably well at navigating that process and doing amazing things now. Tell us physically, what are some of the things that you're doing? Not to brag it up, but tell us about Pilates and you got 3 boys that you're managing. You got a husband that you're managing as well. You practically you're raising 4 boys, right?
Absolutely. 4 boys. Well, I can at least first off run around and chase after all of them, which I wanted to always be able to do, right? And then lifting groceries and without back pain or urinary incontinence or peeing my pants. The other thing that I think is awesome is I never used to do a bunch of pull-ups. I can now do 10.
Oh,
because I've strengthened my core. Yeah.
And how far are you postpartum now?
My baby is 14 months. Okay. So yeah.
So it's been a journey, right?
Yeah, it's been a huge journey. And I had 3 boys in 4 years. Actually, almost 3.5 years. So yeah,
that's a lot of babies to be had for anyone, much less in that period of time.
Yeah.
We'll talk about the steps that you took throughout that journey. But it's remarkable what you're doing now. You're strong. Your body's strong. You're not living in pain. You're not having any leakage when you cough, sneeze, jump, not having any pain with sex or intercourse. And it's just such a beautiful thing. Most of society thinks that these are normal, right? It's very normal to have these things. And I would argue that it's common, but it's definitely not normal. And whatever stage you're at with, post-pregnancy, even if it's 20 years later, the majority of these things you can correct. So tell us about your delivery. Let's start there. And let's just talk about the third delivery and the process. Who was the healthcare workers involved? What was their role? And let's talk about each step that you took along the way.
Okay. My third delivery was interesting because my water broke at home.
And that was a first for you?
That was a first. Most of the time, I just go into labor and then they break it for me. But my babies do come really fast. So I have an awesome OB, though, that believes in taking your time and not just pushing out the baby, which I think is very important on your pelvic floor. So when I got to the hospital, I had this realization in the back of my mind, like I could never deliver an unmedicated birth, meaning like no epidural. But I wanted to wait and let my body labor on its own. I didn't want Pitocin yet. I just wanted to let it happen. And I didn't realize I'd already had been contracting. I was at like a 5. And a couple hours later, I was starting to feel my contractions closer together. And the nurse, I had asked her, I was like, I think I want the epidural now. And as I was using the bathroom, I was shaking. And I was like, this is not normal. And the anesthesiologist came in. And as he was giving me my epidural, I was screaming because the baby was coming and I didn't realize it. So the nurses all rushed in. My doctor had not arrived at the hospital yet. So that was kind of scary because I hadn't done the breath work or the relaxation techniques for a natural birth, which, by the way, I think every woman should do, regardless if you're planning on having an epidural or not, because you just never know. You didn't. If I had had more of like a meditation or a breathing technique, I don't think I would have chosen an epidural.
Knowing what you know now, why is this breathing so important for your pelvic floor?
Because you have to breathe in order to activate or inactivate. How do I make that term? Deactivate or like relax your pelvic floor, right? It's all about breath work. I didn't understand that before coming to pelvic floor therapy. And now that it's like a brain muscle connection that you make.
Yeah, and when you're in this fight or flight mode where you're just fearful or you're anxious, like all these emotions are happening and you don't have a choice to have an epidural, that essentially you got to be prepared for really anything. Yeah. Right? You might have in your plan that, yes, I'm going to have a medicated birth, but if that baby's coming quick, we don't have time to medicate. You know, as a team. So it's really important that, you know, you have multiple options to your birth plan. And in the pelvic floor world, if you don't know how to relax your pelvic floor and you're having those contractions, you might be squeezing your muscles as the baby's coming out, and essentially you're fighting against yourself. And learning how to relax those muscles through a contraction, it's a process, and it's something that you have to work on and practice. And if you haven't mastered those techniques, when you get in that moment, you're going to be most likely squeezing those muscles, trying to push a baby out, but you're literally doing the opposite of what you should.
Yeah, actually, that was my case, that whole scenario, because I was waiting kind of probably for my doctor, but the anesthesiologist was like, hold still so I can get this epidural in you. And you do not want to hold still when you're laboring. That was the last thing that I wanted to do. So I think that's exactly what I was doing. Yeah. Because he would have just probably came out if I could have just relaxed. Yeah. So
I love that. You as you reflect on that, you're like, well, now that I have been through pelvic floor physical therapy, this is something that definitely I'd want to know before the next one, right? You have any more babies?
Probably one more.
So now you know for the next one. That's great.
Yeah.
So had the baby, healthy baby, ended up getting an epidural, it sounds like.
Yeah. So I got an epidural and I was numb a little bit, and numb enough that I felt comfortable enough. My doctor rushed in right there as the nurse was telling me.
Dr. Pearson, he's a saint. When you see him come in the door, just immediate peace,
yes,
right?
My anxiety went down. I think had he had been there, I might have said no epidural. Like even my husband was like, do you really want this? The nurse was like, you're already doing this. Had the anesthesiologist come in 5 minutes later, wouldn't have been an issue. And if Pearson had been there. So
why is it so important to have a doctor? Let's just talk about Dr. Pearson for a minute. Love the guy. He's like a brother to me. He's delivered our babies as well. Literally love him so much. What are things about Dr. Pearson that you just love?
I think for one, so he actually delivered my oldest when he was on call. And I have so many friends, actually, so a lot of them are my nurse friends that I worked with that have him as a doctor. So I was texting them and they're like, you are going to love him. I'm like, oh, I'm glad that you guys know him. His demeanor is so calming when he walks in the door, and he doesn't just get to know you. He gets to know like Taylor and where you're from and about you. And he spends time with you one-on-one instead of just rushing in and out. And I think that's so important as a provider, to get to know your patient, whether they're your patient in your office or your on-call patient. And he takes things slow, and he treats you as he'd want his wife to be treated, I think, just with respect. So, and I think that's something that my husband really appreciated, which is funny because I had a female doctor before, which she was amazing too. But my husband was always a little bit like, oh, let's go to a female. But then he instantly was like, no, I love Pearson. Can we switch to him?
Yeah.
So,
you know, what I love about Dr. Pearson is even the first visit, he just sits down with you, and he has his computer right in front of you, but he sits knee to knee, and he asks you about your goals and your plans and how you're doing and about life, everything outside first. He really gets to understand you and connect with you. And then he asks about your ambitions and what do you want with this pregnancy? What are your, talks about your whole history and your past children, right? So there's this huge connection piece that he works on. But man, I remembered it was 3 a.m. when we delivered one of ours. And it typically is. The man's just, he wakes up and it's like he never went to sleep. He's just ready to rock and roll. And I remember we were in labor as we were driving to the hospital, and it was the first natural labor. And my wife wanted to go natural. She didn't want to do medicated. And when she got there, she was dilated to the maximum. She was ready. And we were like, we don't have time. And she even asked for a bath. She's like, can I get a room? And the nurses just kind of laughed. And we kind of held off to the last minute because there was just multiple things that were happening. I'm like, yeah, we're not ready yet. And then we waited the last minute. We got there, called him, and my wife was going through labor, and we had a good plan. And she was like, I can't do this. And I remember looking in her eyes, and I was like, we can totally do this. We have a plan. We're doing this, but I'll do whatever you want. And she's like, I need an epidural. I need it. And I just wanted so badly for her to get what she wanted, which was, she wasn't trying to be Superman. She just wanted to be able to control her pelvic floor and have a good, recovery with her pelvic floor. She also had some hip dysplasia, and one of her hips got really injured through one of the epidurals because her hip socket was really shallow. And a nurse had pushed on her leg when it was completely numb and no control, and it damaged part of her hip. So she didn't want the epidural for multiple other reasons. And I was totally with that. I'm like, yes, as a pelvic floor therapist, I really recommend that you don't. Let's do everything we can, but I also support what you decide. And then all of a sudden, Spencer walks in, Dr. Pearson, and there was just this peace that overcame both of us. And I remember he put his hand on my shoulder, and like I said, he's a brother to me. This guy, I love him so much. And he looked at my wife and he says, you got this. And she said, okay. And essentially said, yeah, I do got this. But that assurance for us as a couple was so helpful. And then he put his hand on my shoulder again and put me in front of him. And he just said, keep going. You guys are doing awesome. And we were doing this counter pressure on her pelvis. She was going through the contractions. And he put me in the center of that as a husband. And it was so empowering for me because I wanted to be that. I wanted to be that for her. And he set the stage for it. And he helped us be successful in it. And then the minute he was ready to do his part, he said, what position do you want to be in? And she wanted to be in sideline, laying on her side, and she delivered that baby. He caught it. He had me cut the cord, and it was just this amazing experience together. But it was so peaceful, and I'd highly recommend that you find an OB like him. What recommendations would you have to find an OB like Dr. Pearson? Not everyone lives in Utah, or not everyone knows who he is. Maybe his practice is full. I don't even know now, but everyone's heard about him. The news is out. His practice is practically full now.
Oh, absolutely. I went there not long ago for an annual, and his nurse is like, Kiana, you've sent us a lot of patients. I'm like, I know. I should be your patient coordinator. I think it's so important.
We got to talk about Cindy. We'll come back to Cindy.
His
we
nurse,
all love her too.
She's the best. I think it's really important to interview. Not even, I hate saying the word interview, but go and have a checkup with an OB and kind of fill it out. But one thing that I really like is that they are a private practice. They aren't connected. Well, yeah, of course they have part of the hospital, but they're their own practice. And I think that's so important because those doctors tend to spend more time with their patients when they're a private practice, in my opinion. So
why do you believe that?
Because they're not working for a system with other rules. They get to make their own rules and limitations. They get to say yes, they get to say no, which Pearson will always say yes. He came and delivered all my babies at 3 a.m. too, even if he'd worked an on-call shift the night before and worked all day in clinic and then worked the clinic the next day. He did the same thing. I'm like, guy's a Superman.
He really is.
So yeah, no, I think it's so important to, and like reviews online are, they're good, but ask around. Like, I think it's hard as humans to ask others, like, who would you recommend, especially something taboo like an OBGYN, but it's good to ask around, right?
Yeah.
Ones that you trust. And just because you go to an OB and don't feel like it's the right fit, you can always say no. You can always advocate for yourself. I had a friend who actually, the doctor was great. She just didn't feel like she clicked with him. And she was 20 weeks into her pregnancy and she texted me and goes, I don't know what to do. And I said, call Cindy. They'll get you in. And they did. They made it happen. And she was so relieved after. And it had nothing to do with the other doctor. He was great. She just felt like their personalities just didn't work.
Yeah.
So,
and why is that important in your mind?
I mean, giving birth to another human being is like, it's so scary, but it's also so personal, right? And it can be the scariest moment of your life. Being a female and being there, and even being a husband, being there. It's so important to have somebody that can advocate, that you feel comfortable with, especially if you want to go for a natural birth or if something wrong happens, you want to have that peace of mind and have that relationship with the doctor that you're comfortable with.
Yeah, it has to be a deep, abiding trust, right? Because if something doesn't go right and they give you recommendations in the moment, you need to trust their recommendations and what they would do in that situation. And if there's this sort of tug where you don't have that trust, if you're put in that situation, it is really hard. And then if something goes wrong, deep down, you might regret that, right? And it like we want strong advocacy for finding a provider that you deeply trust. So if you don't have one, go get one, because there's so many good ones out there. And just because you don't vibe with one, that doesn't mean they're a bad provider, right? It's some of it's personality based, some of it's maybe some triggers in the past that have happened, but ultimately find one that you deeply love, because that relationship is so deep, right? My wife and I are connected so much to Dr. Pearson and Cindy because of the experiences we've had, because those are such intimate experiences that you get to work as a team to make those things happen. Tell me about Cindy's role.
Oh, Cindy. So Cindy is Dr. Pearson's nurse, and she's worked for his clinic for like a really long time before.
She looks like she's 27. I don't
she
really know.
She dresses like a 27-year-old. She has fashion.
She really does.
She just like, I want her to be my mom. I'm like, I want you to be my kid's grandma because you're just the funnest. I'm sure her kids just absolutely love her. And I know she's just she's a great nurse. So she coordinates. So typically when you like call and make appointments, you talk to Cindy. If you like, when I was pretty sick with my pregnancy. So I would call and talk to Cindy and she would call in the medicine for me. She kind of coordinates all that. She'll make the calls to you. She's
pretty
like
much
his
talks
assistant.
you off every clip.
She absolutely does.
And she's so good at validating. She's like, I got you, sister. Like, yeah, I totally understand. Yes, I'll talk to Dr. Pearson. I'll get back to you today. Right? Like she just coordinates so much, and it's such a valuable piece of that puzzle. And if we didn't have Cindy's, then man, there'd be so much difficulty. I mean, I can't say what Cindy does for Dr. Pearson, but I know that he deeply appreciates her, right? Because she does so much for the bridging the gap and collapsing, the things that he has to do. But it allows for her to specialize in what she does and him to specialize in what he does and do their best jobs for what they do in those roles. So anything you'd add to that?
Just that I love her and I'm appreciative of her. And you nailed it. Like she really does validate. And like anytime that like, even I've had like friends that are trying to switch to Pearson, I'm like, just call Cindy. She'll fit you in. Because a lot of times you'll call the front desk and they're like, we're full. That's another thing. You can always ask to speak to a nurse or an MA. There's usually wiggle room for them to get you in. This isn't just for like an OB, but it's any doctor's office. Because a lot of people don't know that because their schedule might be different than what the front desk sees. And I know that firsthand. So anybody's wondering
100%.
that.
If you me as a therapist, if someone texted me or messaged me, it was a past patient and they're like, I called your office, I can't get in for 3 weeks. The majority of the time, I can find a spot within a day or two, right? There, and I know things about my own schedule. I'm willing to shift things around to be able to get people in that the front office doesn't know, right? And they deal with different complexities, so they're acting on the best knowledge that they have. So it's not that they don't want to get you in, it's that most of the time the providers or assistants to providers know a lot more about the schedule and how we can tweak things around to make it work. So that's a great insight and a great hack for getting in, and it's really important. So tell me about this. We're talking about beyond the 6-week follow-up, right? So you go back, you meet with Dr. Pearson, you're 6 weeks, and he's so good at this. Tell me about your experience with him, and tell me about what your friends experience. What's societal's knowledge about that 6-week follow-up?
So when you go in for your 6 weeks, they make sure if you had stitches, that your stitches are healed. If you've been bleeding still, if you're having any pain with intercourse, well, you shouldn't have had intercourse yet, but he will ask you that.
No sex yet until 6 weeks.
They don't ask you that, but you shouldn't.
Why? And let's just pause there and talk about why you shouldn't have sex before that 6 weeks, just so people know.
So you're healing down there. So, I mean, personally, as a woman, I don't want to be touched for a while. The hormones that are happening, but you're sore, you just gave a birth. You know, it's like an open wound in your uterus because of your placenta. So it's a huge risk of infection if something were to happen, you know. So they want you to be completely healed before.
Yeah,
and it
you
is
think
important.
about the pelvis, the way it expands. You're literally taking the pelvis and you're essentially partially breaking it apart, right? Like you're stretching it so far for the baby to come through the birth canal and the stomach as well. So it is a wound, right? Because it's been stretched so far and then it's rebounding back and it has no stability, right? And for all that skin and all the uterus to shrink back down and heal and repair, we need 6 weeks for all of that to happen. And especially if you've had stitches as well, right? It's not ready for any motion. And having a good recovery program for that 6 weeks is really important as well. Not pushing too soon, you know, not running within that period of time, not exercising hard, because your body is literally healing. It's like you got an open wound and you're just going to go tear it open every day and check it out. It's like, how's the healing going? Right? We don't want that. So tell me more.
Actually, interesting enough that you say rest. I heard this thing, and I'm trying to remember if it's like 5 days in bed, 5 days by the bed, and 5 days like walking around your house or something like that. Because as a mom with other kids and a woman, you just want to get out of bed. I mean, I'm always like, I can go on a walk. I can do anything. I need this, but it's so important to rest for your pelvic floor and for it allowed you to heal. So not pushing yourself in that 6 week time, because that's another thing Pearson has asked, have you started exercising? And I'm like, it's really hard for me not to, but I'm always like, no, I was good. I might walk. But one thing that I think is important is you can do breathing, right? You can do breathing exercises before, which I didn't know until pelvic floor therapy. Had I known before, I probably would have integrated that after each and during pregnancy.
Yeah, there's simple exercises that you can do to use the muscles that actually feel really good. Breathing is one of them because you learn how to relax and slowly contract your pelvic floor so it learns how to rebound. Immediately after my wife had the baby, as soon as everything was stable, I went and compressed her pelvis. So I just got on both sides and pressed inwardly, and she just expressed how good that felt. Right. And I had her squeeze her stomach muscles, contract, relax. So when we talk about exercising, we're not talking about doing burpees or sit-ups, right? That's a progression in itself that should come on after 6 weeks, but also through a rehab experience and being cleared by someone that's professionally be able to give you advice on that. So that's a process, but we're talking about just simply squeezing a muscle and relaxing a muscle. It actually feels really good and your body craves it. But getting those tools and knowing what you can and should be doing in those early phases is really crucial.
Yeah. And it also will integrate into your exercise routines, right? But you're right. You can't just jump into burpees because you'll actually ruin and not help your pelvic floor. What's the word I'm looking at? You'll
essentially inhibit it from healing, right?
Yeah.
You're trying to skip too many steps. It's like taking a baby from laying on its back to now running. You know, it's a big gap. You think about like if we have their baby on their back, that's the first neurodevelopment position. And then what is it from there? Well, let's figure out how to roll. And then let's figure out, okay, how can I do tummy time? Right? How can I lift up my head, develop the strength to be able to do that? Right? We don't teach babies just how to walk right out of the womb. There's a step-by-step process, and the same thing after having a baby. There's a step-by-step sequence that we follow to know that you're ready to do a sit-up. So unless you've been cleared to do a sit-up, I personally don't feel that you should, right? And that's from treating thousands of women over the years, is going through those sequences and knowing that you're having closure if you've had rectus diastasis, which is the separation in your linea alba in the middle of your stomach. If you can have that closure as you sit up, that's what we're looking for, right? But there's so many things that we teach in pelvic floor therapy that's really important to know how to go through those steps and know when it's appropriate to run. Because if you're just running at 6 weeks, there's a lot of things that happen. Tell me about what you hear from your friends and just what society thinks about this. Like, I'm cleared at 6 weeks.
A lot of times, obviously, it's like, oh, at least from a man, oh, they can have sex or they can do this or that. Oh, I can start working out. And it's like, what kind of working out are you talking about, though? I actually think a lot of not like home programs or gyms aren't equipped to help women to ease back into it. So I found it very informative and helpful to find a program that was like a back to mommy program. And there are multiple home ones if you want that will start from the bottom and then figure out how to check for that diastasis recti. You know, that's so important. But my biggest thing is every woman should go to a pelvic floor therapist after having a baby.
Let's talk about that. Why?
Because your muscles have been stretched to the max. Even if you don't have diastasis recti, or you're not peeing your pants, you need to make sure that everything is healed and help you heal it. I know that outside of the US, they do a lot of pelvic floor therapy. And I feel like this happened to my aunt. She was fine after having kids. And then years later, she started having bladder issues. And she's a huge athlete, like huge. And to this day, I tell her, I'm like, you should go to pelvic floor therapy. So you hear of like older women in nursing homes or even assisted living or your grandma that have to wear these Depends. Well, that is not normal. You shouldn't have to be wearing Depends at 60, 70, 80 years old. And I think it's something that's overlooked.
Yeah,
for
absolutely.
Women.
I have a friend that is a little bit older, in her 60s, and she's having some leakage. And I treat this all the time in the clinic, right? Yeah. But her doctor told her that the only way to fix that is through medication. And you want to get me riled up. You know, in the relationship with her is a little challenging where I don't really jump in much because the trust there is just not at that level. But ultimately that was really frustrating for me because the perception from the patient now is, well, my physician, my doctor told me that the only way is medication to manage this the rest of my life. Well, who are they going to believe, right? How hard is it for a physical therapist to then come in and say, no, that's not the only way, right? But part of our this revolution is we got to work together as a team to know each other's skills, to know what resources we have to help people through these things, because most of society thinks it's normal to pee when you cough, sneeze, or jump, right? And we need to not normalize it. We need to say, yes, it's common, but we can fix that. There's a step-by-step process in which you do fix that, even if it is 20 years later. You know, but there are surgeries out there. There is medication to help you manage these things, but around 80 to 85% of these cases can just be fixed with pelvic floor therapy. Give me your top couple reasons. Give me your top 3 reasons for going to PT after having a baby.
Okay, so at my 6-week checkup, I always wondered if I had diastasis and never understood how to check for it. But I also never realized how to correctly. I actually started following this pelvic floor therapist on Instagram, and she's well known.
It wasn't me.
No, I should have followed you first. Totally you probably have heard of her, Doc Lizzie. And I started following her, and she would say all these things, and I'm like, I had no idea that's how you breathe. I had no idea this and that. And I'm like, this is like a big deal. Like I should have gotten pelvic floor therapy before having kids, or like at least after. And so I asked Spencer, I said, Pearson, at my 6th week, I'm like, I feel like I need pelvic floor therapy because I also had pain with intercourse after both my other two. And it took a long time to like, feel like normal. And he even said that wasn't normal. So he's like, I want you to go see a pelvic floor therapist. I'm like, thank goodness I had a provider that was, which also you don't have to have a referral now to see a pelvic floor therapist or a PT for that matter. So yeah, that's nice. And it was really nice that I got in right away. And I think it's really important to also find a pelvic floor therapist that you can see, because yes, you have to be committed to doing the exercises, right? But for me, I'm way better if as a new mom, it's easy to put off things. I'm busy, I'm tired, I have my other kids. But with you, I saw you, I think twice a week for 6 weeks. So that meant I had to do the exercises, or else you would know if I wasn't doing those exercises. And I think being committed to that helped me heal faster. So that is something I think is really important too.
Yeah, absolutely. Yeah. There's so many reasons. So you talked about rectus diastasis, you talked about pain with intercourse. Those are two big reasons, right? Yeah. At some point, after having the baby, you had some back pain as well.
Yeah. And then I also had lower back pain. That was another thing too, that I was like, is this from my epidural? Like, could have happened from my epidural? Could have happened because of my pelvis? Could it be my diastasis recti? Do I have it? Like, what's going on? And obviously he was like, if it doesn't feel better, come back. Now, me being the stubborn person I am, I thought I'll just put it off for a while because I was done with pelvic floor therapy, and it did get better. But then I started working out and doing other things. And there were certain times when I'd be lifting weights that it would hurt. And it got to the point it would hurt so bad that I couldn't move. I couldn't sleep. And I thought it was my bed and I didn't know. And my husband obviously was coming to see you for his shoulder and told you about it. And Taylor came home and said, you need to go back. So I think having that little push, because even myself I was a pain in the butt to do it. And
what I loved about what you did is that there's what we call episodic care, which is like we're going to see you for an episode where it's like, we're going to see you for 6 weeks. But then there's the prevention aspect where it's like, I just need to figure out if my pelvic floor is doing the right things, right? And then there's I'm just having some weird symptoms going on and I just need some direction because where I'm going is not going well, right? And with your back, it was very inconsistent where it was like, let's touch base here, let's touch base in 3 weeks, let's touch base in a month, right? But it was part of this journey that you're on rather than like, let's just go, week by week by week until it's all better, right? But now it's more of a, let's touch base when you need it.
Yep.
How has that helped you?
A ton, because I think that at the beginning it was totally fine. And as I was exercising, lifting weights is when it got like, cause it was like my hip flexors too, right? It wasn't just pelvic floor. It was more than one problem going on, but it was really helpful to know that my PT, aka you, didn't just write me off saying, oh, clean bill of health, she's done. We don't have to worry about it. That I always had somewhere I could call and get in right away. And it got to the point where I was doing Pilates consistently, and Pilates did help, but I had a Pilates instructor that was like, you are so inflamed. Like, you should go back to pelvic floor therapy. This isn't normal, Kiana. And that felt validating that it wasn't in my head, even though my husband was telling me, yeah, it looks inflamed. And then coming to you felt even more validating when you're like, this is not normal. This is absolutely not normal, and we're going to help you feel better.
Yeah.
So,
and what I loved what you just talked about, you talked about multiple people that were part of your journey.
Yep.
You talked about Taylor, your husband. You talked about your Pilates instructor. You talked about your PT. Right? It was, and then you, right? That's 4 people collectively working together for your benefit. And that's so cool that you utilized each one. You listened to your husband. Right? You listened to what he was saying. You listened to your Pilates instructor. You listened to yourself and your own intuition to say, I'm going to do something about this. And you have all these external things that are happening in life that are pulling you away saying, I don't have time. I got other kids. I got other priorities, right? But then you made an active choice to prioritize yourself. What advice would you have to moms that have a hard time prioritizing them?
Well, I always think back, how can I take care of my kids if I can't take care of myself? If I'm not feeling my best self, then I can't expect to take care of my kids adequately. So that was my biggest thing, is like, I need to be feeling good and not crying all the time because my back hurts, or not being able to lift my kids because my back hurts, or being a fun mom because I have boys. They like to be rough and they want to play and they want to run and ride bikes. So I wanted to be that for them. So
when
that was
you can't
my push.
do those things, what does that do to you?
Oh, it put you in the most depressed state ever. It was really hard. There were days I would cry about it. I remember in Pilates, I was in my favorite instructor's class and I was trying to do just basic moves I'd done before. And I have never walked out of a Pilates class. I'm very stubborn. I can do this. And I walked out bawling. And I love the studio I go to. It's not just Pilates. It's like everything, and it's wellness, and it's, and I remember the front desk girl looking at me. She's like, "You're not okay." And I was just bawling. And then after the Pilates class was over, my instructor walked out and walked me into a corner and just like let me cry and talked to me and validated me. She's actually a mom of 3 boys herself.
Tell me her name.
Her name's Bianca.
And
She's
then
great.
What's the studio you go to?
It's Awaken Studios, and
Awaken.
Jenna and Joe own it. Jenna's also very amazing and was also very helpful in my pelvic floor therapy as well.
Yeah, we're going to tag them in this podcast because I think they need to hear this.
Yeah.
And realizing what they did for your journey.
Yeah.
Because it's each role plays a critical part in your recovery.
Mm-hmm.
And without one person,
Mm-hmm.
I don't think you would have got the same outcome.
No. And honestly, without Awaken, I don't think I would have at all. I think I would have just pushed it to the side and not listened to myself.
Yeah.
So it was really validating to have other women that also have had kids that have been there,
Yeah,
And
it's this whole, I mean, we talk frequently about this, but this village of people
Mm-hmm.
that really care about your recovery and want you to succeed at the highest level. And one of our purpose statement for our clinic is to help people live the life they always wanted.
Mm-hmm.
Right. And I love hearing your story of like being connected with your kids and your family and living your best self so that way you can be there for them.
Mm-hmm.
Because, one thing that I see frequently is moms often neglect themselves because they're taking so good care of their kids.
Mm-hmm.
And they don't realize that their kids would thrive so much more if they were thriving as well.
Yep.
Because they're often looking at your example, not about what you say, but about what you do.
Mm-hmm.
So if you're telling your kids, I want you to live the best life possible, but you're not doing it yourself, what's the message we're sharing?
Mm-hmm. No, it's true. And now my kids see me go to Awaken and they want to copy what I do, but they love the daycare there. So that was like a big push, as you said, because I would tell Jenna, my neighbor at the time that owns Awaken, about my pelvic floor issues or about this. And I was going to pelvic floor therapy. And she sent me like a VIP, like try it out pass. And she said, when you're ready. And then a month later, she sent it again. And it was just the push that I needed to go and try it out and try out something else called Wild, which is dancing and meditation and something that I could take in to even if I have another baby one day, And it's become a family to me and a community, and I get excited to go working out and get excited to go there and feel like major FOMO when I miss it.
I love that.
So
as we wrap up this podcast, I think you've given so much good practical advice for women that are recovering from having a baby. What last advice would you give a woman that's close to delivery about who to have on their team, why pelvic floor therapy is helpful, and why having the right trainers after physical therapy is helpful? What advice would you give to them?
I would make sure you talk to your OB about pelvic floor therapy after and how important it is. Like, regardless whether you think that you need it or not, to get evaluated for it and have a plan, have a game plan on how to get there. Even during pregnancy is really important. And I would advocate rest for yourself too after. And having multiple birth plans is super important. Also, not to like throw off pelvic floor therapy, but I do think Pilates is great, and I wish everybody could do it in conjunction with pelvic floor therapy.
100%.
It's so awesome. Yeah.
In the physical therapy world, one thing that I really want to improve, there's an article that one of my mentors wrote called the PT on the front lines, but not engaged in the battle. And it's a 1-page article. It's so good. It's written by Lee Dibble, but what it does is it simply explains that physical therapists are literally on the front lines to help people recover, but we're not building the bridge back to gyms, right? We're getting them done with rehab, but we're not building the bridge to the next step. And that's something that I hope to solve in the next 5 years of my career, is that we are doing our part to create relationships with personal trainers, with gyms, that we are literally building this bridge and help connect people back to what they truly want to do. The hardest part is time, right? Is making these connections in the community and building those, consistently connecting with them. But physical therapists really need to understand, who are my referral sources in the community and who am I referring to, right? How many gyms do I know in my area? I should know every personal trainer. I should know every gym. And if I'm treating therapists and I don't know every gym in the area, I'm feeling a little anxious as a therapist, because I'm like, it's my fault. Like, if I don't know every gym in the area, it's my fault. If I don't know every trainer, I need to know them, because my next patient, like Kiana, is coming in and they love Pilates, but they can't find a gym. I can immediately create that connection because I know that's worked well in the past, right? And then we're going to build that bridge, build that connection piece. I get them to them. They're doing their Pilates. They might get slightly injured, and it's not in their wheelhouse to help them through an injury. They say, do you need to go back, get a touch up, and then come back? But it's this respecting each other's professions and saying, you're not in the right place right now. I want you to be here, but there's limiting factors in your ability to be here. Why don't you go back, stay in the gym? And as a physical therapist, I want people to stay in the gym too. It's like, no, keep doing that. I'm going to teach you the things to modify slightly. If I need to reach out to your trainer, I will. And then there's this communicative piece going back and forth to get you to full recovery. But that's something I really hope to solve in the next 5 years in Utah, is to build that bridge more.
I think that's amazing.
Because I really want to, because I hear your story and, you know, many stories from different women I work with, and that bridge is so crucial.
Yeah.
Because those Pilates instructors are so talented at what they do, and it really takes people from the rehab to full level fitness.
It's true. But it's also finding a right Pilates studio too, because somebody that's very knowledgeable about the body, right? I find important
Helps,
too.
They've had babies before.
And that will go and correct your form.
And
not afraid to
sit with you in the corner when you're going to cry.
Yeah, or sit with you in the corner when you're going to cry.
Yeah.
So important.
Any last thoughts on your experience or the things that you went through? Any other just last thoughts?
Just that women are amazing and incredible, and you're not alone. Nothing's wrong with you, and it's okay to ask for help, and it doesn't make you weak at all. In fact, it makes you strong, and to always advocate for yourself.
I love that.
So
yeah, make sure you get the right resources, you know, and these helpful tips that Kiana shared, use them, because they really make a big difference in your health. So thank you for joining us today, Kiana. We appreciate your insight and your story.
Thank you.